Well, I'm sharing 1201, so we'll go ahead and get started here. This is Allie Orwig with the Indiana Rural Health Association. We appreciate everybody joining us today. We've got a really great presentation to follow up our excellent program from last week. If you haven't had a chance to check that out, it will be posted on our YouTube channel. You can always view our archived webinars by visiting our website at indianaruralhealth.org and checking out our archived webinars tab, or going to YouTube and searching Indiana RHA. We have a host of great educational webinars on there. But today we will be talking about the Marketplace Open Enrollment with Tina Darling and Ann McCafferty. Just a couple quick housekeeping items. If you want to ask questions during today's presentation, you are always welcome to use the chat function or the Q&A function, which you can find by hovering your mouse over the screen. Some options will pop up either at the top or bottom of your screen, depending on which view mode you are in. I will be acting as moderator today. You can always send those to me. Again, my name is Allie Orwig, and we'll get to those at the end of the session. Or you can use the raise hand function at the end when we open it up for questions and answers, and we can unmute your line and you can ask your question verbally. So we will have a couple options for questions at the end of the session. As with our previous session, we are recording today. We will have this up and available for viewing at a later date if you want to share or rewatch the presentation, again, both on our website and our YouTube channel. So without further ado, Tina and Ann, I'll turn it over to you.
Thanks so much, Allie. Again, I'm Tina Darling. I am the Program Director for Connecting Kids to Coverage at the Indiana Rural Health Association, and I'm here with my colleague, Ann McCafferty, who's one of our project coordinators and licensed Indiana insurance navigators. And today we're going to give a quick overview about Marketplace Open Enrollment, your options, and how to prepare. Next slide, please. Again, our disclaimer, as we shared last week, talking about our funding from the Centers for Medicare and Medicaid Services. Next slide. And for today's learning objectives, at the end of today's session, I would like for you to come away being able to summarize the information and documents needed to apply for Marketplace coverage. I'd like you to be able to differentiate between the plan levels and how to understand your application results, including eligibility for tax credits and cost share savings, and also to be able to explain the advantage of applying with assistance from a Marketplace Certified Application Counselor, or CAC. Next slide. A little bit about our program, and in full disclosure, these first few slides will be a repeat if you did tune in with us last week. But we are funded through CMS to the Indiana Rural Health Association. We are one of 39 grantees in this national campaign. We have a 3-year funding cycle. We're nearly halfway through this one, and we hope to be eligible for another one. Our program goals include raising awareness about health coverage that's available under the Children's Health Insurance Program and Medicaid, but also for Marketplace options, because we can count how many children we enroll in Marketplace as part of our CMS reporting. So that's why we're doing this today as well. We want to create opportunities for families to get their eligible children and teenagers signed up for coverage. And we want to motivate parents to not only enroll their children and teenagers, but also to keep that coverage renewed from year to year so that they don't drop off. And then we want to work with CMS in a collaborative way to provide outreach guides and toolkits that a variety of organizations can use to promote this topic within their demographics. Next slide, please. So let's take a look at health coverage in Indiana. This kind of sets the stage for why we got this coverage, why we got this grant rather. Next slide, please. Here's a map showing all of the states who have expanded Medicaid since they opened that up. Indiana was, we opened up our Medicaid coverage in 2015, and it was really important for Indiana because up until that point, healthy adults in Indiana between the ages of 19 and 64 really had no backup option if, for example, they did not have employer-sponsored coverage, or if their employer-sponsored coverage was cost prohibitive. So this was a really great thing for Hoosiers in Indiana, And it prompted a lot of parents not only to get enrolled, but also to start considering having their children get enrolled. Next slide, please. And then in Indiana, you can't talk about healthcare access without looking at both access to health coverage through insurance programs, and then also where can I find a provider. This is a map called Indiana's Medically Underserved Areas and Populations, or MUAP. It comes out every year. This was the most recent one I could get my hands on, so I'm waiting for the 2020 map to come out. But any area you see colored in with green, pink, or blue means that there is a shortage of healthcare providers in Indiana. And if you can look at it from this perspective, it's nearly half of our state. So we're hoping that with telehealth restrictions being lifted during the pandemic, that the face of this map may actually change going forward. We really, really hope so. And we're hoping that the powers that be will realize that things like telehealth do work. It is a viable option. So let's hope that this map changes for the good going forward. Next slide, please. And then I want to take a quick look at Indiana's numbers for health coverage before the pandemic hit. Next slide. Here's another map similar to the last one, but this one shows the uninsured rates for non-elderly people by age. And I say non-elderly because this is everybody up to age 65 when you qualify for Medicare. So if you look at this map, Indiana's uninsured rate in 2018 was approximately 10% average. Of that 10%, 7% of our children are eligible for coverage, but they don't have it. And about 11% of adults are eligible for coverage, but don't have it. So this is part of the reason why the Indiana Rural Health Association was awarded this grant by CMS, so that we could start trying to work on these numbers to improve them. Let's see if we can find those families who are eligible for coverage in the state and help them walk through the process to get it and keep it going forward. Next slide, please. Since the pandemic, next slide. I wasn't able to find any data specific to children, but there were some declines in enrollment before the pandemic was happening. But this began reversing in March, as you can see from this slide. Those orange bars on the right illustrate how after the pandemic hit, people who either became ill or family members became ill with the pandemic, they started realizing that they needed health coverage, or they may have lost employer-sponsored coverage through a layoff, and they turned to public health programs like Medicaid and the Children's Health Insurance Program. So we've seen an upturn since the pandemic hit in March. Next slide, please. This is just another way to look at it. I like looking at us in comparison to other states. And I've noted Indiana here with the green arrow and the red circle on the bottom. This is enrollment from February to May of 2020. So I'm glad to see that we were not one of the 3 states where health insurance enrollment did not increase. Indiana is about keeping pace with the rest of the country on this. Next slide, please. So Hoosiers have a lot of options for health care. Last week, we talked about Medicaid and CHIP, the Children's Health Insurance Program. I mentioned a minute ago, if you're 65 or older, you are eligible for Medicare. And then if you're a veteran, there are some options for you to look at. There's employer-sponsored health coverage. But today, we're going to talk about marketplace health insurance, and I've noted it here in red. And this is a really great time for us to be talking about it, because open enrollment for 2021 eligibility starts next month. November 1st through December 15th are the open enrollment dates if you want to start coverage as of January 1, 2021. Next slide, please. So I'm going to turn it over to my colleague, McCafferty, who is one of our top licensed Indiana navigators, and she's going to talk to you from a very high level about how Marketplace works and how you can prepare to meet with a certified application counselor and to know what to expect. Thank you, Ann.
Thank you, Tina. And I'm so happy you've joined us today for our Lunch and Learn. I hope you have a little lunch available, and we will just kind of sit back and go through what open enrollment looks like for you if you're interested. And I'm really going to bring this down to a consumer level. I want to talk to us all as if we are consumers and we are interested in looking at a marketplace plan ourselves. Kind of what that looks like, where to go, what to expect, what documents you might need, etc. So we'll start at the beginning. What is the marketplace? As you saw on the previous slide, there are those who have health insurance available through a variety of ways, but not everyone, as an example, has a job that offers health insurance benefits or qualifies for a public health program such as Medicaid or Medicare. In 2010, a comprehensive healthcare reform law called the Affordable Care Act, or the ACA, you might know it as Obamacare, was enacted. One of the primary goals of the ACA reform was to make health insurance available for those people who don't have access through one of those avenues that Tina mentioned earlier. As a part of the ACA reform, every state now provides a marketplace or an exchange where those without access to health coverage can apply for eligibility determination, compare a variety of plans and plan coverage levels, and possibly qualify for additional savings to out-of-pocket cost. Because all the plans sold through the marketplace are qualified health plans as defined by the ACA, consumers can shop with confidence knowing they are protected under the ACA guidelines and free from risk of denial for coverage due to pre-existing conditions, and also know that they are purchasing a comprehensive plan and not a limited coverage plan. So how does someone find this health insurance marketplace, and can I purchase a plan at any time? Next slide, please. In Indiana, you will do this by applying for eligibility determination through healthcare.gov. And you can do this during a set period of time called open enrollment. Open enrollment for plan year 2020, which Tina mentioned, will begin November 1st and will continue through December 15th. There are special enrollment exceptions outside of the open enrollment period, and I'm happy to discuss that in more detail if anyone's interested. But because we are so close to open enrollment, we're going to move on to our first learning objective and discuss the information and possible documents you will need to apply for marketplace coverage during that open enrollment period. So how do you apply? If you have a computer or access to a computer and the internet, simply type healthcare.gov into the URL address bar. Next slide, please. Now, I want you to take a minute and familiarize yourself with healthcare.gov's home screen, and I'll tell you why. If you search at Google or whatever your search browser is, something like Marketplace or Healthcare in Indiana or something like that, you may be directed to a website that is not healthcare.gov. And that could put your personal information at risk by giving it to one of these copycat sites, I like to call them. So once again, here is that picture of what the healthcare.gov website home screen looks like and where you should be directed. Next slide. So what if you don't have a computer? How do you then apply? There's a couple different ways. You can make an appointment with an application counselor or an assister with an affiliated marketplace designated organization, such as myself at Indiana Rural Health Association, or with a health insurance agent or broker. And we'll talk about the differences in these type of assisters in a little bit. You can also call healthcare.gov and request that a paper application be mailed to you, or you can most likely obtain this from an agent. I have them, I can give those to you. Or you can call healthcare.gov and speak with a representative over the phone who will assist you as you apply over the phone. Next slide, please. Before you decide to apply for eligibility determination to purchase a marketplace plan, there are certain requirements that must be met in order to do this. You first must live in the United States. You also must be a U.S. citizen or a U.S. national, and I'm going to add one, or a lawful permanent resident of the United States. And lastly, you cannot be incarcerated. Next slide, please. Sometimes it may be necessary to confirm your citizenship or your immigration status, and you might be asked to submit supporting documents to do so. I'm not going to read all of these, but to do this, you can look at this list. You can do so by providing one of the documents on this slide, or next slide, please, two of the documents from the left-hand column and one from the right side from the slide. So it's pretty specific about how you can verify your citizenship or immigration status. Next slide, please.
And Anne, if I could
Yes,
just say, everything that was listed on those two previous slides is on the internet at healthcare.gov. You can find all of that information in case you missed it. So
perfect, thank you. So prior to starting your application, you will need to gather some information to complete the questions. It is recommended that you have this information in front of you, whether you are applying with the assistance of an agent or an application counselor such as myself, on the phone, or with healthcare.gov, or by that healthcare.gov paper. You should be prepared to provide the names, dates of birth, and social security numbers for everyone in your household who is applying for health coverage. You will also need to know how you plan to file your taxes in 2021 and what your tax filing status will be. You will also need to have an estimate of what your annual household income will be in 2021. To clarify the definition of a household a little further, it is generally yourself, your spouse if you're married, and your tax dependents. That income estimate will include everyone's income in the household and not just those applying for health coverage. For instance, let's say that I'm applying for coverage through healthcare.gov. My husband has health insurance through his job and is not applying for coverage. Because he is my spouse, he is considered a part of my household, and I need to consider his adjusted gross income when providing my estimate on our household income for 2021. If you don't anticipate a change in your household income from 2020 to 2021, a good resource would be your 2020 income tax return to estimate your modified adjusted gross income for that upcoming year, 2021. Next slide, please. Now keep in mind, income is just not what you make from your job. There are examples of earned income, and you can use these references to find what your earned income might be. Your 1040 wages and tax statement, like I mentioned before, pay stubs, or if you're self-employed, your self-employment ledger documentation, or again, your tax return from last year. Next slide, please. Also, you must count your unearned income. There are several examples of unearned income. I'll highlight a couple. Unemployment compensation, a lot of people receive that this year, so that would be countable income in your household. Another example, Social Security disability income, or maybe a retirement or pension income. Outside the earned and unearned income information, there's a couple other things you will need to have on hand, and I'll touch on these real quick. You should also be prepared to provide any policy numbers for current health plans covering members of your household. For instance, in my example, my husband was already insured through his employer. You would need to have his insurance information available for the application. If your employer offers health insurance coverage, even if you are not enrolled, you may need to gather information about that health coverage offer and knowledge of the benefits and time frame for when those benefits would be offered to you. For example, your employer's open enrollment period. Next slide. You may not always be asked to provide supporting documents with your application, but if you are, this will be requested in your application eligibility determination results, which you receive after you complete your application. If your application results do indicate that you need to do this, you can submit documents to healthcare.gov a couple of different ways. Healthcare.gov recommends that you do this by uploading your documents through your online healthcare.gov account. When you apply online, you are asked to set up that healthcare.gov account. So you're right in there, you're all ready to go. You just need to upload. Of course, you can ask your agent or assister to help you complete this process. If you know you're not going to use a healthcare.gov account, or you don't have a computer, or you're just old school and you like touching paper, you can send these documents through US mail, but just as a reminder, don't send your originals. Make sure you only send your copies. So I mentioned earlier that when you apply for Marketplace, you may qualify for additional savings. After you apply, again, you will receive those results. Those results will also indicate to you what savings you may be eligible for. Next slide. The first way you may see savings on the cost of your health insurance plan is called a premium tax credit. A premium is what it costs every month that you have health insurance. It's like car insurance. You don't wreck your car every month, or at least I hope you don't, but you still have a monthly payment amount to ensure that your car is covered by insurance in the event you do wreck your car. So that's the same thing. A premium for health coverage is what you pay every month to have health insurance. A premium tax credit, or a PTC, is a refundable credit that is applied to your health insurance premium to reduce the cost. You can only get this premium tax credit through the Marketplace, and it can only be used for a Marketplace plan premium. You must also meet certain requirements to qualify for a premium tax credit. Next slide, please. To better understand a PTC, let's use Bob as an example. Bob sets up a healthcare.gov account and he completes an application. He's answered all the questions and has entered his income estimate as accurately as possible. He receives his application eligibility determination results from healthcare.gov, and it says something like, based on your household estimated income of $56,000, and I totally just made up these numbers. So if you make $56,000, don't think you're going to get this tax credit. This was just for easy math. So he is eligible for a $6,000 premium tax credit based on his estimated income. He looks at the plans that are available to him on healthcare.gov, and he selects the plan that he would like to enroll in 2021. The premium, remember, the monthly cost for this plan is $600 a month. Again, I'm not trying to blow you away. I just made that number up. How can Bob use that premium tax credit to save him money? Bob can choose to advance this credit to help him afford the cost of his monthly premium during 2021. This is called an advanced premium tax credit, and you'll see this called an APTC. He has the option of spreading that $6,000 out over 12 months, so $500 a month, and this $500 a month credit goes toward his $600 premium payment due, reducing Bob's amount that he owes to $100 a month. He could also choose to distribute the credit to only a few months out of the year, or he can choose to pay the insurance company $600 every month without advancing that tax credit and receive his credit in the form of a refund or as a credit toward any tax obligation he might have that year. Now, this is important to reconcile that credit so it goes toward your premiums, either in advance or if you hold on to it. You must file income taxes for that plan year, in this case 2021, and include an IRS form 8962. Because your eligibility for savings, such as the premium tax credit and the next savings program we're going to talk about, is based on that estimated income from your application, this is why it is so important to gather all that information so you have a very firm idea of where you think you will be. Next slide. And then there is another savings that you may qualify for, and this is known as cost sharing reductions. And once again, this is only available for Marketplace plans, and more specifically, silver tier Marketplace plans. And we'll talk more about tiers of plans in a little bit. So when you have health insurance, you do have other out-of-pocket expenses related to the cost of that health insurance, such as a deductible or co-insurance or co-payments. We could probably have a whole nother lunch and learn just on those. So I'll quickly give you an example how extra savings in the form of a cost-sharing reduction can lower your cost. If you qualify for a cost-sharing reduction, you will notice that there are some plan options that have considerably lower cost-sharing amounts. Let's use, for example, a deductible. A deductible is the amount of money you must first pay out of your pocket before the insurance company starts sharing their portion of the cost with you. So if you qualify for a cost-sharing reduction, you may notice that some plans have a deductible of $5,000. However, in the silver tier level, there are a few plans that have a considerably lower deductible of, say, $300. Or another example is copays. I think we're all familiar with copays. If you go to a specialist and you choose a gold plan, you may have a $50 copay to see that specialist, where there's a silver plan option that is going to reduce that same visit to that specialist down to a $10 copay. So these noticeably different plans will all be in the silver tiers, as I mentioned, and you will want to choose one of those silver tier plans to have this extra savings apply. And go ahead and skip the next slide, and we're going to go to the next slide. Oh, that's great. Stay right there. So back to Bob. So Bob's applied. He received his results. He knows he's eligible for certain cost savings, like the premium tax credit and the cost share reduction. But he doesn't know what plan is right for him. Every person has a unique situation, and this definitely is not a one-size-fits-all. The plan that seems just right for Bob may not work for his friend Mary. Next slide. Here is a basic overview to understand the different plans. And remember, we talked about those tiers. Marketplace plans are grouped into metal tiers like platinum, bronze. Platinum, gold, silver, and bronze. Honestly, I do not ever remember seeing the option to purchase a platinum plan in my experience with the Indiana Exchange. So I'm going to focus more on just the gold, silver, and bronze for now to explain what that percentage means. If you remember, I talked about cost sharing expenses, what you might have to pay out of your pocket. This is an example. So if you purchase a gold plan, once you reach your deductible, your insurance agrees to pay 80% of the expenses from that point on, and you will be left with the remaining 20%. A silver is a 70-30 split, and then a bronze is a 60-40 split, leaving you responsible for the 40%. Now keep in mind this, preventative services such as a mammogram or a colonoscopy, you do not have to reach that out-of-pocket deductible amount before the insurance company will share the cost or cover it entirely. And you can look at these types of explanations of benefits when you start selecting your plans. Next slide, please. And again, the right plan truly is unique to every individual. I'll give you a quick example. I have two sons. My one son is 26. He never goes to the doctor. He rarely gets sick, but he wants the peace of mind of having health insurance in case, God forbid, something does happen. So he might choose to look at a lower monthly premium in the bronze level, because the odds are probably in his favor that he is not going to meet his deductible. So he just really wants that peace of mind, once again, of having health insurance and paying the low monthly premium. Now, my other son is 30. He is facing a potential knee surgery. He would not want a bronze plan because he knows he wants to get to his deductible as quickly as possible because he wants to start sharing costs with the insurance company instead of taking all the costs. So he may consider a gold plan, which has a higher monthly premium, but again, he's going to benefit from that higher percentage of coverage once he has that expensive knee surgery. All right, next slide, please. So I have to admit, as a application counselor, I do get a little excited every year right before open enrollment. It is a little bit like Christmas for all of us, I think. Just like you, the consumer, we do not know who is going to offer plans this year on Indiana's healthcare.gov. More specifically, what those plans will cost, what they'll look like. We do know this. We do know that Managed Health Services has joined the Indiana Healthcare Exchange again, now under Celtic, if you're from Boston, or Celtic, if you're from Scotland. I'm not sure how to say it. CareSource, again, rejoins. They were a company from last year. And then in Lake Porter and LaPorte counties in Indiana, Anthem is making an appearance back into the marketplace in Indiana. Next slide, please. So this question comes up a lot, and I'm quickly going to go through this because, number one, I'm not an immigration attorney, and there are a lot of questions associated with applying for programs, state programs, federal programs, and the marketplace. So what I can tell you is this. If you live in Indiana and you don't qualify for Medicaid because you are a lawfully permanent resident, but you have not yet met the 5-year requirement to receive a Medicaid program or an Indiana health coverage program, you can apply for Marketplace. The requirement for a Marketplace lawful permanent residency status is you just have to be a lawful permanent resident. So I actually had someone 2 days after they were effective looked at Marketplace plans and were able to purchase one. So when in doubt, ask. And if we don't know, we will go to the right resource to find out the information you do know. All right, next slide. So what is the advantage of using a certified application counselor like myself? Number one, it's free. Free is always good. To differentiate between a certified application counselor and an agent, we do not get paid for what you might choose. So for instance, if you choose CareSource over MHS, it does not make any difference to us. We are strictly there for assistance and as a service. We are trained and certified to assist you with your application at a certified marketplace designated organization such as Indiana Rural Health Association in my case. And to help you navigate you through this application process. It's a lot. I know I covered a lot today. So this is a great example of where you can sit down with a certified application counselor such as myself and feel comfortable answering or asking those questions. We can also help you understand your eligibility determination results, help you assess what plans might best fit your health and wellness profile. And then at the end of the year, if you have questions reconciling those premium tax credits, we can certainly sit down and help you with that as well. So that's a quick overview, and it was a lot, and it was probably a little fast. I hope you wrote down your questions, and I look forward to those. I'm going to turn it back over to Tina for now.
Okay, if we could go to our next slide real quick. And we showed this slide in our last week's presentation as well. licensed Indiana navigators and certified application counselors for Marketplace can be found at any of these organizations. Ours is the second one down, Connecting Kids to Coverage, but you've also got options at Covering Kids and Families through federally qualified health centers, and you can type in your zip code at that HRSA, find a health center, HRSA.gov URL, and you'll find one of Indiana's 250 federally qualified center locations near you. Or if you happen to be in a nearby hospital, you might ask if they have a claim aid representative available to you. Next slide, please. So we are ready for questions. Thank you so much for listening. I hope we can help you out with some additional clarifications.
That's very bright. Sorry about that. So I don't have any questions that were submitted during the presentation, but I will give everybody a quick minute if you would like to chat or submit during the through the Q&A, or now is the time if you'd like to use the raise hand function. We can unmute your line for any of our attendees that would like to ask a verbal question. We have that opportunity as well. But a lot of really good information in there, but a lot of information too. So I know if anybody wants to follow up, do you mind bumping back to the contact information slide in case anybody wants to send questions directly? Are we able to do that?
Go to the next slide, I believe, or the one after that that has my contact information. Yeah, go one more. Yes. And so here's my email address, tdarling@indianarha.org. If you think of a question after today that you want to submit, just send it to me. And if I don't know the answer, I'll find out through either Ann or one of our other team of navigators.
Yeah, I'm still not seeing any questions coming in, so you guys must have just covered it so thoroughly that people can't even think of a question that they have after the great information that you provided today. But now that we've got your contact information, they can certainly follow up in that manner. So we appreciate everybody's time today, especially Ann and Tina, you guys bringing us this information, so very needed, especially as open enrollment is upon us. I know people will be coming to you for more information. So everybody, we hope you have a great afternoon. We'll get this recording up ASAP. Have a lovely, lovely day.
Thank you.